One of the diseases that is highly supported by PEPFAR is HIV, and HIV across the spectrum, from treatment to system strengthening to community empowerment to human resource, laboratories, name it, including supply chain. And all this is work that greatly impacts the life of people. And Uganda as a country, we have over 1.4 million Ugandans living with HIV. Out of the 1.4, we have around 1.3 that are on treatment, meaning that every day they have to take the ARVs to ensure that they live longer. And the cutting of the freeze is a scare. It's a scare for me as a person advocating for health rights. It is a scare for me as a person living with the communities and as a person who is working with civil society, and I've seen organizations close because of this freeze. We have a couple of organizations that had to say, we are stopping, because it was immediate order. It's stop work now order, and immediately on 24th, when the stop work order was out to the civil society and all implementing partners in the country, for example, Infectious Disease Institute, known as IDI, had to immediately close. We've seen MAPI, which provides programming for key population and people population across the spectrum, including sex workers who need prevention, treatment, and prevention and treatment at the same time. We've seen even grassroots organizations, small and but very powerful in providing services for children living with cancer and HIV, which is Kawempe Home Care, also closed. And everyone is wondering what is going to happen to all these people that these facilities have been providing services to. And I think as of yesterday, we thought this impact is not biting in government facilities, and we thought it was just maybe privately supported programming for HIV treatment. But as of yesterday, we've seen communities sending messages from Barara, from Guru, saying that now in some of the facilities, you cannot go and access your refills for the ARVs. And they are being told to go in the pharmacy which is a model that government started, what we call the pharma model, that they distribute treatment for people living with HIV through the pharmacy model. It was meant to make sure that people can access medicine at your nearest point. And pharmacies are usually close to the communities, especially in the greater and central Kampala region. But now it is supposed to be for free. But what we are seeing is that communities are saying they are being asked to pay 10,000 for a person who is living with HIV and has to go for refill, and you're not sure on when you'll be able to get your 3 months. The whole purpose of why we had put 3 months refill, actually that even moved to 6 months refill, is to reduce the cost of time, money that people invest in to go to facility to pick their refills. If I have 3 months, I don't have to budget for transport to go to a facility, and also going there and spending time when you can invest that time in something else. But that is going to be affected if I'm now again being taken back to getting 1 month refill. So it has an implication on this person economically, but also for me as a person working in the sector of women. We know that women are the ones who flock facility to get refills. We get refills for our children, we get refills for ourselves and our partners. It is a cost mentally, but also it may increase violence in the home and stigma at the same time. So that worries us a lot, of the people living in uncertainty, of not being sure on whether I'll get my next refill. We know government is telling us that we have stock to cover 3 months, but we are not sure by the 3 months, even when we got some hope of, they've lifted on delivery of treatment, but the people to deliver are not there. The human resource was told to go home, stop work and go home. So even though the treatment is available, who will distribute? We need people to be in the facilities. We used to have what we call community extension workers, peer educators, mentor mothers. These are people who ensure that services are close to the community. That if there is a person with a disability and cannot roll this wheelchair to the facility, a peer mentor, mother, or a community extension worker can go pick the card and a book, pick the medicine from the facility and take it to this person. But that is not there anymore. So what is going to happen to this person? If you're not able to support yourselves to go to and pick your medicine, they will definitely give themselves holiday. Even we've had cases where people are telling us that if someone has been taking the pill every day, but now you're not sure after 3 months that I will have this pill, they're saying, okay, I can take one today, maybe I stop tomorrow, I take another, so that I save and I have a longer period. And that has disruption on adherence for people living with HIV, and definitely we'll have issues where we have people not adhering, have viral load up, and chances of increased reinfection and new infections in the public is going to be very high and costly. Just even the pause as it is right now, for supply chain, even if you pause for a second, it has an effect because there are orders, and orders are as per the time, from the time you put in your request to where it goes for approval. So every pause really has an implication on how will the treatment move from the origin, maybe for Uganda's case, let's say from national medical stores to the user.